Pregnant lady, one pregnant lady helping another pregnant lady. Patient again act. Don't move. I said you. Calm down. Hey, laugh patient. Come here. Take your chair and come. Until what time you have to do the CPR?
Until we can do maximum till 30 minutes, or until the ambulance should come, we have to wait. Or if someone else is ready to do the same procedure, we can transfer it to this person.
Or if the patient wakes up. Or if the patient wakes up.
Patient wakes up.
Like the band, like the cloth bandage strap-on.
Gauze.
Gauze. We'll get that and we'll cover it. Then we'll call the police.
Okay guys, one more thing for Madam, please. Madam Instructor. Chest wound. First, what are the signs of chest wounds? Bladder bleeding from the open chest wound, the absorbing sound from the wound at each breath, spitting of the blood, shortness of blood.
First, algorithm. We'll go by algorithm. First, check your safety. Then go near to the victim. The victim will be mostly conscious, okay? After that, you introduce yourself, like I'm a medical volunteer, I'll help you. Then after that,
If possible, ask the victim to give pressure on his wound when he exhales.
after that, you lift the victim in a, and keep him or her in a half-seated position, okay? How you lift the victim? First, head part, okay?
One hand for the head part and another one for the neck part.
Slowly
you have
to go like this. Okay?
You have to insert like your leg into the back.
Then place the victim like this. Then afterwards, you have to take one plastic bag. Okay? Why we are using plastic cover? Okay?
Maybe to closing we can use cloths.
We can use cloths and etc.
Why we are not using cloths?
Air will go.
Yes, air will go.
Like when compared to cloths, this
plastic
will
is more better,
block
right?
the air, like going inside, okay? Because the complications of accumulation of air in the thorax is yes, there will be pneumothorax. So to prevent this, we are going to put a three-sided valve. Why we are? I mean, what is the? I mean, why it is given like this? The name for it, I'll just tell you. So for example, there is a wound here, okay? Chest wound, for example, okay? You will place this plastic cover when the victim exhales the air, okay? While exhalation, you have to apply this plastic cover. And after this, you have to seal the three sides. Why you are sealing only three sides? Because there will be bleeding.
There will be bleeding. Why we are closing only these three sides and we are leaving this side without sealing?
Because like there will be bleeding, so the blood has to come out, okay? So for this we are creating only three-sided valve. We are like letting it one side open, okay? Then after this, and while doing this, you have to call ambulance.
Simultaneously.
Simultaneously.
Maybe if you call for the help, if somebody comes, you just ask the person to call.
After putting three-sided valve, you have to make the victim. For example, he has got wound this side. So you have to tilt the victim little bit, okay, this side. And you have to keep on like be like this, okay? You shouldn't. You
should not. After sealing that, you should not leave the victim on the laying position, or maybe.
No sitting position,
yes.
No lying position, only half seated position. And also you have to make the victim like tilt in a side where the wound has occurred, okay? So in case if the victim has got gunshot wound, so you have to seal the back side also, okay?
For that you have to check the back side, right? So how you will just...
It's better to look like this. okay, from the back side. Don't tell the victim, just look it from this side. Then if there is anything, like for example gunshot, if there is any other trauma over here, and again put the 3-sided valve. If here, in case if there is a left side trauma, you have to leave the one side open in the left side itself, not in the right
We
side.
have to open the lateral side. Breathing, but he went unconscious now. We'll just put the patient on the respiratory position. In this case, which side you have to put the patient on the respiratory position? The wound side. The which side we have wound for right side now, we have to put the patient on the respiratory position right side. Left side now, we have to put the patient on the
I'm a medical volunteer. I'm here to help you. Do not worry. Please give a pressure. Please give and say the exact location and tell that the patient is
Good.
chest. I'm putting the patient in a hospital. Hey. Please come.
It's very painful.
Second.
I'm trying.
Please calm down.
More emotion.
I'm alive.
Come on, push.
Okay, don't worry. Female age around like 22. I'm gonna put a 3-sealed valve seal bandage on her. Okay. Get me the bandage.
Hey, unconscious.
Okay.
Patient dead.
Somebody there to help me.
I'm helping.
Can you please call the ambulance?
Yes.
Wait. Put her down, check for breathing, then call for alarm.
I'm gonna help you.
Please give me some water, please.
No, I won't give you.
I feel like
Exhale. Breathe out. Yes. So I'm placing the band.
Put pressure. So it is a short-term loss of consciousness up to 2 minutes, which will be associated with impaired blood circulation in the brain. So what can be the main causative factor for fainting? Heat, staphylo, insufficient air, oxygen, everything. Then prolonged lack of food or water. Then next is nervous strain. Okay.
Peace.
Because the main causative factor is improper blood flow to the brain. So slapping on the cheeks makes that, okay. Then splashing on water on the person, so you shouldn't do it. Next is giving them a sniff of ammonia. In case if you are a specialized person, you can give medicines. Since you are a medical volunteer, you shouldn't give medicines. And trying to lift a person until he regains consciousness, then trying to give him any kind of medications. So these are forbidden things you shouldn't give. You shouldn't do.
What is the difference between, for example, unconsciousness and fainting? Person is falling down in front of you, that means he's he's fainting.
Okay.
Further he is not regaining the consciousness or he is not breathing now, then you will do the further procedures. But he is fainting.
So I'll just repeat the first aid, okay, for fainting. First, check for the signs of life, especially breathe. Then, lay down the victim in the even surface. Then, lift the legs above the heart level. Then, unbutton the tightened cloths. Then after that, wait for 2 minutes. If the victim doesn't regain the consciousness, then call for an ambulance. Then inform that this person is unconscious. But if there is, check for breathing, you will check it in the first itself. So if there is breathing, you put the victim in restorative position. If not, you will go with the CPR. So you will be informing this. And after that, go further with the procedures.
Make him come. Make him come. Make him sit.
You can just make him sit.
First you have to know the time. First you have, the person is having a seizure now in front of you now. Okay, 12:42. You remember the time. Epilepsy.
Epilepsy. So first we will check our surroundings and then we will go.
Calling the ambulance.
Ambulance. Okay. We'll wait for first wait for 5 minutes. If there is any repeated, we'll wait for, if it lasts for more than 5 minutes, we will call the ambulance. First thing, and second thing, if the seizure, it reappears, we have to inform.
Why stroke happens is because death of brain cells. So, cause can be due to high blood pressure, impact blood flow, or alcoholic, smoke. These are some risk factors or causative factors. So main thing is due to death of brain cells, the stroke occurs. Okay. So it's a medical condition in which poor blood flow to the brain causes cell deaths. So what can be the risk factors? Lack of physical activity. Okay. Next is obesity, smoking, stress.
Fastest.
Because the symptoms are based on this drooping of face, then weakness in the arms, then slurred speech, and also the time is onset of time. Okay, you have to note on the time. So that is the main thing.
Third thing, fainting.
Fainting for 2 minutes
seizure,
for fainting, epilepsy for 5 minutes. This has no particular time. You have to
note down the time.
Onset of the time, you have to
you
calculate.
have to note that. So in case of fainting, you wait for 2 minutes. So if he doesn't regain the consciousness, you'll call for ambulance. In case of epilepsy, you have to call ambulance. In case if the seizure lasts for 5 minutes or repeated seizures, if the victim is pregnant or sick or epilepsy in water, etc. Or if the patient asks for help, medical help, you have to call for an ambulance. So in case of stroke, you have to call ambulance immediately. First, note down the time. First check for the fastest, note down the time, then call for an ambulance.